Welcome to the deep dive. Today we're tackling a really interesting topic in veterinary medicine,
Mm,
inflammatory myopathy. This affects dogs, and sometimes, though less often, cats.
right. And think of it like this. It's what happens when the body's own defense system, the immune system, makes a mistake and starts attacking its own muscles.
Exactly. And we're basing our discussion today on the information from canine and feline inflammatory myopathy.
Hmm.
We're aiming to pull out the key insights.
Mm-hmm.
For all of you listening who like getting to grips with complex stuff quickly, that's the plan. We want to break down what these conditions are, maybe what causes them, how they're diagnosed, treated.
And maybe touch on some of the more surprising bits along the way.
Yeah, so let's just jump in. What is inflammatory myopathy, fundamentally?
Okay, so myopathy on its own just means muscle disease. Pretty straightforward.
Right.
Adding inflammatory tells you inflammation is the problem causing the muscle damage. Now, our source gets specific about polymyositis. It defines it as an immune-mediated condition.
Immune-mediated, meaning the immune system is driving it.
Exactly. The body's immune system mistakenly attacks the skeletal muscles. And pathologically, you see this infiltration of lymphocytes. Those are specific white blood cells into the muscle.
So they're kind of invading the muscle tissue where they shouldn't be.
Precisely. And that causes the damage.
Okay, so that's polymyositis.
Yeah.
Then you mentioned dermatomyositis. How's that different?
Good question. Dermatomyositis is basically polymyositis, but it comes with characteristic skin lesions.
Ah, so derma for skin.
You got it. And what's really interesting, especially in dogs, is that sometimes these skin problems can actually be more obvious to an owner than the muscle signs.
Really? So you might see a skin issue first.
You might. It's a key thing to remember. Skin changes could actually be pointing towards an underlying muscle problem in these cases.
Huh. Okay, that's definitely worth noting.
Hmm.
So how does this inflammation actually cause the problems we see? Like what's happening in the muscles?
Well, the inflammation itself kicks off a cascade. It leads to muscle weakness, stiffness,
Hmm.
and pain. The technical term for muscle pain is myalgia.
Myalgia, got it.
And if that inflammation sticks around, it can eventually lead to the muscles wasting away, which is called atrophy.
Okay, so weakness, stiffness, pain, and potentially wasting. What actually starts that inflammation? We mentioned the immune system for polymyositis. Are there other triggers?
Yeah, definitely. The immune system attacking itself is one major cause, the focus in polymyositis. But you can also get inflammatory myopathy triggered by infectious agents.
Oh, like what kind of infections?
The source lists a few specific ones, parasites like Toxoplasma gondii, Neospora canis, Sarcocystis species.
Okay.
Also, some tick-borne diseases are implicated. Interestingly, though, the text points out that actual bacterial infections directly causing this kind of myopathy aren't that common.
That is interesting. So parasites and tick diseases more likely than bacteria. Anything else?
Yep. Certain drugs can induce it, so drug-induced myopathy. And another big one is when it's linked to cancer.
Cancer. How does that work?
It's called a paraneoplastic syndrome. Basically, the muscle inflammation happens either as a consequence of an existing cancer somewhere else in the body, or sometimes even before the cancer is obvious, a pre-neoplastic sign.
Wow. So the body's reaction to the cancer affects the muscles. That's complex.
It really is. Immune-mediated, infectious, drug-related, cancer-related. Quite a range of potential starting points.
But when this inflammation gets going, which parts of the body feel the effects? Is it just the leg muscles people usually think of?
Well, the neuromuscular system is definitely hit hard. You get that generalized muscle involvement limbs, yes, but also the muscles used for chewing, the masticatory muscles.
Ah, so trouble chewing could be a sign too.
It could, but it doesn't stop there. The gastrointestinal system can be involved, particularly the throat or pharyngeal muscles and the esophagus in dogs.
Okay, why the throat and esophagus specifically in dogs?
It comes down to muscle type. In dogs, unlike in some other species, the muscles lining the pharynx and most of the esophagus are skeletal muscle.
The same type as in the limbs.
Exactly. So if the immune system or another trigger is targeting skeletal muscle generally, those GI muscles are vulnerable too.
And what happens then?
A major clinical sign can be regurgitation. That's where undigested food comes back up passively because the muscles aren't working properly to move it down.
That makes sense. A direct link between the muscle type. What about the skin you mentioned earlier? That's mainly for dermatomyositis, right?
Primarily, yes. The skin lesions are characteristic of dermatomyositis. But you can also see skin involvement if the myopathy is part of a broader, more generalized immune attack on connective tissues throughout the body.
Gotcha. Okay, this definitely affects multiple systems. Let's switch gears slightly. What about genetics? Is this something dogs or cats can inherit?
That's a really important aspect. For autoimmune diseases generally, the specific genetics can be complex and aren't always fully understood. But the source is clear that a genetic predisposition is usually needed. Basically, the animal needs to have the right genetic background for it to potentially develop.
So genes play a role, even if we don't know all the details.
Right. And we do know about specific breeds. For example, there's a familial form of autoimmune polymyositis, meaning it runs in families seen in Newfoundlands and Vizslas.
Okay, so a clear hereditary link in those breeds for polymyositis. What about dermatomyositis?
For dermatomyositis, the genetics are a bit clearer. It's reported to follow an autosomal dominant inheritance pattern in breeds like rough-coated collies and Shetland sheepdogs.
Autosomal dominant, meaning you only need one copy of the gene from one parent.
That's right, which explains why it can appear relatively consistently in those breeds. Australian cattle dogs are also mentioned as being predisposed.
So definite genetic links in certain breeds, even if the broader picture is still being filled in. How common are these conditions overall? Do vets see this a lot?
The source suggests that generalized inflammatory myopathies aren't actually considered common.
Okay.
However, it does add the caveat that recognition might be increasing,
Yeah.
maybe better diagnostics, more awareness. It's hard to say for sure, but they're seen worldwide.
And mainly in dogs.
Yes, dogs are affected more often than cats, where it's quite rare.
We touched on breeds, but maybe we can quickly recap. Which breeds should owners be particularly aware of?
Sure. For polymyositis, think Newfoundland, Boxer, Vizsla, those are highlighted, but other breeds can get it too, in dogs and cats.
Right.
For dermatomyositis, it's really those rough-coated collies, Shetland sheepdogs, and also Australian cattle dogs that have the known predisposition.
Good to know. And does it tend to show up at a certain age?
It differs. For polymyositis, there isn't really a clear average age of onset mentioned. It can vary.
Okay.
But dermatomyositis typically appears much younger, often around 3 to 5 months of age.
And quite young then.
Yes, and interestingly, for both conditions, there doesn't seem to be a strong link to whether the animal is male or female.
Okay, so breed and age seem more significant than sex here. Now, for the really practical part.
Yeah.
What signs might you actually see in your pet? What are the red flags?
With polymyositis, one of the most common things is a stiff, sort of stilted way of walking. It might come on suddenly, or it could develop more gradually.
Stiff gait. Okay.
Variable muscle pain, they might seem sore or reluctant to be touched. Generalized weakness is a big one, and exercise intolerance. They just tire out much more easily.
That must be worrying to see.
Definitely. And because of that potential throat and esophagus involvement we talked about.
Regurgitation.
Exactly. Regurgitating food or having difficulty swallowing in the first place. You might also notice muscle swelling early on or later, muscle wasting atrophy. And sometimes this can lead to a condition called megaesophagus, where the esophagus is enlarged and floppy, making regurgitation even worse.
Wow, quite a list of potential signs for polymyositis. How does dermatomyositis look different symptom-wise?
The key difference with dermatomyositis in dogs is those characteristic skin lesions.
Right, the skin part. Where do those usually show up?
Often on the face, the tips of the ears, the tail tip, and sometimes over bony areas on the legs or paws. So seeing those skin issues, perhaps along with some muscle weakness, should definitely make you think about dermatomyositis.
And generally, for either type, would the muscles feel different?
Yeah, often the animal will show pain if you gently press on their muscle groups. And over time, you might just notice a general decrease in muscle mass, including those chewing muscles we mentioned earlier.
So if you notice these signs, you take your pet to the vet. What happens next? What does the vet look for in an exam?
Well, they'll do a full physical and a neurological exam. Often, the neuro exam itself might be pretty normal in these cases.
Oh, okay.
But if those pharyngeal muscles in the throat are involved, they might find a decreased gag reflex. Blood work is also really important.
You mentioned creatine kinase before.
CK.
Right, serum creatine kinase, or CK. It's an enzyme that leaks out of damaged muscle.
Right.
So elevated CK levels definitely support the suspicion of myositis, but, and this is crucial, it's not definitive.
Meaning you can have inflammatory myopathy even with normal CK levels. So a normal test doesn't rule it out.
Ah, okay. So it helps if it's high, but doesn't exclude it if it's normal.
Precisely. And that's why the source really emphasizes that ultimately you usually need a muscle biopsy to confirm the diagnosis.
Taking a small piece of muscle tissue.
Exactly. To look at it under the microscope.
Okay, so diagnosis isn't just based on symptoms. What other conditions could look like this that a vet needs to rule out?
Good point. There's a list of differentials. Things like polyarthritis inflammation in multiple joints can cause stiffness, but you'd usually find joint pain and swelling, and analyzing joint fluid helps distinguish it.
Makes sense.
There are also non-inflammatory muscle disorders, but again, the biopsy would show different changes. Then there's polyneuropathy problems with the nerves, not the muscles themselves.
Can you tell those apart? Weakness could look similar?
Or could. That requires a detailed neuro exam, maybe electrophysiology tests, things like EMG that measure electrical activity in muscles and nerves, and sometimes even nerve biopsies.
Okay, more specialized tests.
Right. Chronic disc disease in the spine can cause gait issues, but the neuro exam and maybe CK levels can help point away from that. And one more is myasthenia gravis.
Oh yeah, I've heard of that. Affects nerve-muscle communication.
Exactly. Causes episodic weakness. But there's a specific blood test for acetylcholine receptor antibodies, the AChR test, that's usually diagnostic for myasthenia gravis.
So it's a process of elimination using different clues. What about specific lab tests or imaging for suspected inflammatory myopathy?
Besides the CK, vets might run a serum antinuclear antibody test, an ANA titer. It can sometimes be positive if there's a more widespread autoimmune connective tissue disease going on.
Okay.
They might also check for other concurrent issues like hypothyroidism or even heart muscle inflammation myocarditis. A blood marker called cardiac troponin that can sometimes give clues about heart involvement.
And imaging. X-rays.
Yeah, if the animal is regurgitating, chest x-rays are really useful. They can show if the esophagus is dilated or enlarged.
I guess esophagus.
Right. Or even spot signs of a possible tumor if a perineoplastic cause is suspected. They'll also look at the heart size on the x-rays. And if swallowing is a major issue, a dynamic swallowing study might be done.
What's that?
It's basically a moving x-ray, often using contrast material, to watch the swallowing process in real time and see if the pharyngeal muscles are working correctly.
Very specific. But you keep coming back to the muscle biopsy. Why is that considered so essential?
It really is the gold standard, the most important test, according to our source. Because the inflammation can be patchy, affecting some areas but not others.
Ah, so you might miss it if you only take one sample.
Potentially. That's why it's often recommended to biopsy multiple muscles, or at least take samples from a muscle known to be affected, maybe guided by those electrodiagnostic tests like EMG.
Okay. And what other procedures might be done?
An echocardiogram, an ultrasound of the heart, is often a good idea to check heart function, especially if myocarditis is suspected. And those electrodiagnostics we mentioned, the EMG and nerve conduction studies, help confirm it's a muscle problem, assess severity, and guide biopsy site selection.
So you get the biopsy samples. What exactly are pathologists looking for under the microscope to say, yes, this is inflammatory myopathy?
They might see obvious signs like muscle fibers swelling or shrinking, becoming atrophied. But the classic finding is those mononuclear cell infiltrates the immune cells, mostly lymphocytes, clustered within the muscle tissue.
The invasion we talk about.
Exactly. Sometimes other inflammatory cells like neutrophils or eosinophils are present too, but less commonly. They might also see signs of muscle trying to repair itself, regenerating fibers.
Any ill clues?
Rarely, if it's one of those infectious causes, they might actually see parasite cysts inside the muscle fibers. And in really chronic, long-standing cases, you see a lot of muscle atrophy and fibrosis scar tissue replacing the muscle.
So the biopsy gives that direct visual confirmation. Okay, let's say the diagnosis is confirmed. What can be done? What's the treatment?
Usually this can be managed on an outpatient basis. If the animal is really severely affected, maybe can't walk well, then good supportive nursing care is key to prevent things like pressure sores.
Right.
Activity should generally be increased gradually as their strength comes back with treatment. And dietary changes can be really important, especially with regurgitation.
Like the elevated feeding.
Yeah, feeding smaller meals more often from a raised bowl. Sometimes changing the food consistency helps too. In really tough cases of regurgitation, a temporary feeding tube might even be needed to make sure they get enough nutrition.
And what about educating the owner? What do they need to know?
It's crucial they understand that for the immune-mediated forms, treatment often needs to be long-term, potentially lifelong, with immunosuppressive drugs.
Okay, it's a commitment.
It is. And even with treatment, there might be some permanent muscle wasting or stiffness, especially if the disease was chronic before diagnosis. Genetic counseling is also important for those breeds with known familial forms. And surgery really only comes into play if there's an underlying cancer that needs removing.
Right. Let's talk medications. What's the main approach for the immune-mediated type?
The drug of choice is usually corticosteroids, like prednisone. They're started at fairly high doses to suppress the immune system and get the inflammation under control.
Get things calmed down quickly.
Exactly. Then, once the pet improves, the dose is very gradually tapered down, often to an alternate day schedule, aiming for the lowest dose that keeps the clinical signs and the CK levels normal. But as I said, this might need to continue long term.
And what if it's caused by an infection?
Then you need specific therapy targeted at whatever bug was identified, antiparasitic drugs, antibiotics if relevant, etc. And if there's heart failure involved, that needs specific heart medications too.
You mentioned immunosuppression with steroids. Are there risks or side effects?
Oh, definitely. Corticosteroids are powerful drugs. Because they suppress the immune system, the animal is more prone to infections. Owners might also notice side effects like increased thirst, urination, appetite, maybe some panting or behavioral changes.
And you mentioned something about muscles earlier.
Yes, ironically, long-term high-dose steroid use can actually cause muscle wasting itself, a condition called steroid myopathy. It's something vets have to watch out for.
So what if the side effects are too much or the steroids aren't quite enough on their own?
In those cases, vets might try combining a lower dose of the corticosteroid with a different type of immunosuppressant drug, like azathioprine or cyclosporine. The idea is to get the same or better control with fewer steroid side effects.
A multi-pronged approach.
Sure.
How is progress monitored during treatment?
Regular checkups are key. Vets will periodically recheck the serum CK levels. Ideally, they should come down into the normal range and stay there.
A marker of inflammation control.
Exactly, and they'll constantly monitor for any side effects from the medications, adjusting doses as needed.
Are there common complications to watch out for?
Well, the corticosteroid side effects are probably the most common issue. There's also the risk that if you stop the medication too early, the disease can flare back up, relapse.
Right.
And sometimes, if the initial steroid dose isn't high enough or the disease is very severe, the response might be poor, and that's when adding those other immunosuppressants might be considered.
Okay. So overall, what's the expected outcome? What's the prognosis?
For the immune-mediated types, which are the most frequent, the prognosis is generally considered fair to good, provided the treatment is managed properly and continued as needed.
It's relatively positive.
It can be, yes. However, if the myopathy is paraneoplastic linked to an underlying cancer, especially one that wasn't detected initially, then the prognosis is usually much more guarded. The outcome often depends more on the cancer itself.
So finding out the underlying cause is really critical for predicting the outcome too.
Absolutely. It underlines why that thorough diagnostic workup is so important.
This has been a really fascinating look at inflammatory myopathy. It certainly highlights how complex the immune system is and what happens when it goes slightly awry.
It does. And it shows the importance of tools like the muscle biopsy in getting to the bottom of these cases.
Definitely. You know, recognizing those early signs we discussed, the stiffness, weakness, maybe regurgitation or skin changes, and getting veterinary help quickly seems vital.
Couldn't agree more. Early diagnosis and treatment generally lead to better outcomes, and those genetic links in certain breeds are also a really interesting piece of the puzzle.
Yeah, absolutely. As we wrap up, it kind of makes you think, doesn't it? If the immune system can mistakenly target muscle like this, what other conditions, maybe ones that seem totally unrelated, in pets or even in people, might actually share similar autoimmune roots?
That's a great point. Thinking about that interconnectedness, it definitely opens up questions about future research and how we approach treating a whole range of diseases.
Lots to ponder there. Well, thank you for breaking down this complex topic for us.
My pleasure.